significant life was going to change over the next 24 hours and certainly over the next many months. We all knew COVID-19 would eventually reach our hospital here in Pine Bluff, and we'd prepared as much as possible like most hospitals across the nation, but we just never envisioned that this would be the first place that the COVID pandemic made its mark in our state. I remember that day like it was yesterday. I think my phone started ringing about 9 o'clock, and within an hour, we were on a call with the health department, talking about all the details and confirming basically one of our patients had in fact contracted COVID-19 and was positive. Our incredible team did what they do best. They responded. Our leaders quickly assembled communication and coordination with the Department of Health, the Governor's Office, certainly the Hospital Association and many other constituents. And soon a number of policies were implemented and put in place on behalf of our patients and our visitors, and certainly our employees, to ensure a safe and secure environment was made. Despite a lot of uncertainty and certainly a lot of media attention, especially those first few days, our employees and medical staff did engage and did what they were trained to do, which is simply take care of patients. A remarkable response. Over the months, we had countless numbers of staff and physicians working long hours, certainly a lot of days a week, and ensuring our systems were in place to make sure that we were providing the absolute best care for our patients. Many actually worked a lot of long hours and extra shifts just to make sure that we were doing everything we could possibly do to ensure that we won the fight. Words can't express how personally I'm proud of all of our employees and our team members and our physicians, those on the front line, and certainly all those in the support levels as well. This has been undoubtedly a great team effort here for our organization. Over this past year, Jefferson Regional has treated over 900 COVID inpatients here inside the facility, as well as 1,928 patients on the outpatient setting. Remarkable numbers. And throughout this year, 282 of our employees and physicians have contracted COVID-19. Over the past 12 months, we performed 21,000 COVID-19 tests, and those testing platforms are still very active today. Sadly, and despite a lot of extraordinary efforts, we have suffered an experience of patient loss, and all told, 135 of our patients have lost the battle to COVID-19 while being treated here in the facility. As difficult as the journey has been, we certainly have a lot of success to share along the way, a lot of success stories. Our physicians have been truly remarkable along this journey, not just caring for patients on a day-to-day basis, but ensuring that our staff and our well-being is intact and that we are providing the very best of quality in our organization that we could ask for. I see her in the back, but Dr. Nazneen Jamal, one of our hospitalists, has been our physician lead of our COVID response team with our medical group, and she has truly done an incredible job, and we are certainly proud of her and her accomplishments over this last year. Special thanks to several other physician leaders. Some are in the room. Our Chief of Staff, Dr. Amy Cahill, Chief Medical Officer, Dr. Reed Pierce, Medical Director, Dr. Charles Mabry, and countless other physicians, many of them that are working on the front lines of the ICU. Dr. Al-Nashif, Dr. Mohammed, and Dr. Taylor have been putting in countless hours, making sure over this last year that we are providing the best of care for our patients. I can't say enough about the nurses and the bedside staff that have been taking care of patients at the bedside, and also all the support staff that have made this organization make its way through this. Speaking of which, like housekeeping, it's amazing how important even housekeeping and keeping a clean environment, especially during a pandemic, is to keeping a clean organization. But each and every day we witness certainly the heroic excellence and compassion from all of our staff, and their dedication gives us the fuel to continue moving forward. There is perhaps the brightest story that we've had is our patient number 1, the very first COVID-19 patient in the state of Arkansas. This amazing individual spent many months here at our organization and then eventually transferred to a long-term care facility. And today I'm excited to tell you he is doing well and back to life. Ladies and gentlemen, please join me in honoring Mr. James Black, Arkansas's patient number 1. We're so proud to have you here, you and your family. We appreciate you being here today. I know a lot of people have worked hard and dedicated a lot of hours over the last year, but our next speaker undoubtedly has worked harder than anyone else that I personally know here. In fact, I'm not sure that he had a day off the first 4, 5, 6 months. Isn't that right? Today, we're honored to have him graciously join us in recognizing the tremendous accomplishment and work not only here at our hospital at Jefferson Regional, but for all the healthcare institutions in support of all the healthcare heroes across the state of what we've been doing in this last year. Please help me welcome Governor Asa Hutchinson.
Thank you, Brian, and that's right. I'm here for really one reason, and that is to commemorate this moment in history a year ago, but also to express thanks to those that have been on the front line here at Jefferson Regional Medical Center. And I'm proud of you. I haven't been able to be here day in and day out because you're busy doing your work, and I had a few responsibilities myself. But the whole state of Arkansas is grateful for not just what you've done in healing patients and ministering to people, but also how you've set the example for the state in terms of resilience, in terms of setting best practices, and help us to learn from day one to day 365. And the progress that's been made to a large extent is the result of the work that you've done here at this hospital. So please give yourself a round of applause. Thank you for what you've done. I also want to recognize Dr. Jose Romero, who's our Secretary of Health, I've worn out 2 secretaries during this time. Secretary Nate Smith was here at the very beginning a year ago, and then Dr. Romero has ably come in to provide assistance and lead the effort, and we're grateful for him. Mayor Washington, it is good to be in your city again. And James, is that right? Yes, sir. Well done, well done. Now, I didn't get to meet you a year ago. I know that you've been through it, but thanks for being here and being, just by your living example, sharing a story of this last year. It means a lot to the people of Arkansas that you're willing to be here and commemorate this day. And really, I wanted to start just by a moment reflecting back on 20 years ago. Almost 20 years ago, the United States of America was attacked by terrorists. And we lost almost 3,000 Americans during that time, and we called it our 9/11. Well, 1 year ago, we had our first case of COVID-19 here in the state of Arkansas, and it became our 3/11. And it was our challenge, it was our emergency. On that same day, I declared a public health emergency. We went to work, and we've been at work for the last year. And during that time, we've lost 5,300 Arkansans to the coronavirus. But at the same time, we've seen the resilience of Arkansans. We've seen the magnitude of the capability of our pharmaceutical industry in being able to produce a vaccine that can cure people, or that can immunize people from this deadly disease. And that is the best of America, where we're number one in health, where we can put our researchers to work and say, we've got a problem, what's the solution? And you do it in record time. You get the solution through our scientists, our healthcare workers, and then you put it in production in warp speed. And the result is that today we have almost 17% of Arkansans with 1 dose of the vaccine. That is progress, that is the human spirit, that is the American spirit in action. And in Arkansas, we've seen that same resilience. We've seen that same leadership and that same commitment to our by our healthcare professionals. And I know I came here to honor you and to thank you, but I also want to take a moment to thank all of our healthcare professionals across the state of Arkansas. Bo Ryle leads the hospital effort, and those in the hospitals have done an incredible job. Those are our frontline physicians and our respiratory specialists. They have had to fight the battle day in and day out, and through their work, they've developed better therapeutics and better management. And the result of that is the combination of the vaccine at work and the combination of better therapeutics means that today we drop below 300 in hospitalization statewide, and that is the lowest that we've had in probably 6 or 7 months. And so we're making progress, and yes, this is not a formal report, but I'll tell you that today's numbers are down, hospitalizations are down, and we're making continued progress in this fight against the virus. And we want that day where the pandemic ends, and that day will come. And that day will come when we set the example for everyone to get the vaccine, for everyone to have that life-saving capability and protection that will save lives, and that is our goal. We've learned a lot during this time. We've learned to adapt, we've learned to innovate, and we've learned to fight through the challenges that we face. So with that, I express my thanks to you, and I want to end by noting that there is a sign of memory and a sign of hope for the future, and that is through the donation of the Forestry Division of our Arkansas Department of Agriculture is donating 10,000 oak saplings that you can pick up free of charge to plant in your yard or somewhere in memory of a lost loved one during this pandemic. And as setting the example, I talked to the First Lady, and the First Lady and I will be planting an oak seedling on the mansion grounds with a recognition of lives lost during this pandemic and the hope for the future that we all have. Thank you, and God bless you.
Thank you. I'm Bo Ryle, President and CEO of the Arkansas Hospital Association, and thank you to Brian Thomas and your team here at Jefferson Regional Medical Center for your reaction and care to the first COVID patient, and certainly for the entire year of serving COVID patients. As we look back over the past year, we can certainly appreciate the steady leadership by Governor Hutchinson. Thank you so much for your steady leadership. We've been through some stressful times, and we could always depend upon the governor making a well thought out, correct decision. Our Secretaries of Health, Drs. Smith and Romero, have provided significant and correct guidance as we have tackled every new and previously unknown issue we have faced. It has been mentioned, and I'll say it again, the true heroes of the last year are the healthcare workers who have made great sacrifices and worked long hours to ensure outstanding patient care. They have faced stress and adversity at every turn and continued to care for patients at the highest level. So thank you. As Brian and his team have done outstanding work, I wanted to recognize the great work from our hospitals across the state. From day one, they have continually asked, what can we do? Our hospitals not only organized individually, but set up daily and weekly meetings to share experiences and resources with hospitals in the same cities and regions. This communication was instrumental in balancing the load of COVID patients. When we look back at significant challenges, we can see where hospitals stepped up to meet these challenges. Hospitals agreed to stop non-emergent services to preserve PPE. They set up testing sites across our state when we needed to increase capacity. They worked to provide appropriate staffing when the surge was at its peak and we were stretched very thin on the availability of healthcare workers. When we were anticipating the greatest surge of patients in mid-January, our hospitals increased ICU bed capacity by 19%. And when we needed to begin administering the vaccine, our hospitals set up and continue to operate mass clinics to get the vaccine into arms as quickly as possible. Our hospitals have not only asked, what can we do, but now they're asking, what can we do now to help? Having a hospital in your city or county should not be taken for granted, and I would dare say that after this pandemic, they will be continually acknowledged for their persistent ability to solve problems that we had not identified a year ago. We're proud of the outstanding efforts of our healthcare system and extremely proud of our hospitals during this time. Thank you.
From the Office of the Mayor, On behalf of the city of Pine Bluff, Arkansas, and all of its citizens, I present to you a proclamation in honor of the COVID-19 Day of Remembrance. Whereas the coronavirus pandemic is a global crisis that has impacted almost every community around the world, and the first presumptive positive COVID-19 case in the state of Arkansas being reported right here in Pine Bluff at Jefferson Regional on March 11, 2020. And whereas in Arkansas, in the year since, more than 250,000 cases of COVID-19 have been reported, and more than 4,000 have perished as a result of the virus, including Pine Bluff residents. And whereas, whether friends, family, neighbors, or outstanding colleagues, the lives that we have lost were beloved members of our community who greatly enriched the lives of our city. And whereas the contributions they impact will never be forgotten, and their legacies will continue to enrich the lives of all of those who remember and love them. And whereas we are united in gratitude for the courageous health workers on the front lines of this pandemic, and as they provide that support, compassion, and incredible service to those affected by this virus. And whereas the city appreciates daily the Arkansas Health Department as well as our governor, Asa Hutchinson, in keeping communities updated on COVID-19 through daily press conferences during the initial phases of this pandemic. And whereas the pandemic has forever changed our lives. But we will endure this crisis together as communities united, as we persist through this new normal and hope for better days. Now, be it resolved, the city offers this resolution with great sympathy for the lives lost to COVID-19 in Pine Bluff, the state of Arkansas, across the nation, and throughout the world. Therefore, I, Shirley Moorhead Washington, Mayor of the city of Pine Bluff, Arkansas, proclaim that Thursday, March 11th, 2020, shall be known as COVID-19 Day of Remembrance in the city of Pine Bluff, and I urge all citizens to reflect on those who have lost and remember the lasting influence that they have had on our community. Thank you.
Good afternoon. My name is Kathleen Bottoms, and I am a registered nurse and the manager of oncology practice in the infusion center here at Jefferson Regional. I have worked at Jefferson Regional for 9 years. I am also a COVID-19 survivor. This has been an unbelievably tough year for all of us, but after seeing the pandemic as both as a caregiver and a patient, I have never been more proud to represent our hospital and all others who contracted the virus and recovered. As part of our observance today, I'd like to share a poem by Laura Kelly Fanucci that beautifully reflects overcoming such a life-changing experience, followed by a video that gives you a glimpse into the last year at Jefferson Regional. When this is over, may we never again take for granted a handshake with a stranger, full shelves at the store, conversations with neighbors, a crowded theater, Friday night out, a taste of communion, a routine checkup, the school rush each morning, coffee with a friend, the stadium roaring, each deep breath, a boring Tuesday, life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, we hoped to be, and may we stay the way, better for each other because of the worst.
Man, hit me big.